All right. Hello, welcome. I'm Jonah, and I'm here to talk about the Smith's Medical Fast Flow Fluid Warmer. It's what we commonly refer to as our level 1 rapid infuser. So it's going to be for your trauma patients that need a lot of fluid, either blood or NS or LR, whatever the case may be, quickly. So you're going to find it in the equipment room in the back. Walk right in, head straight back, there it will be. And typically what you'll find with it are 2 sets of tubing already hanging from the machine itself, as well as our quick cheat sheet that we made up, and their Smith's Medical own quick reference guide. So once you get it out, bring it to the room as necessary. We're going to go ahead and get started because you're probably going to need it in a hurry. So start by just taking the tubing out of the box. It should come in one piece already. Discard the instructions. We're going to go ahead and set the tubing into the level 1 first and foremost. So you want to make sure that your tubing is right side up. So the easiest thing to do is grab it by the white bar there, and up is obviously going to be to your spikes that are going to go into your IV bag, and then down is going to be towards where the filter is, and then your line for the patient. So a real easy kind of jingle to remember is 1, 2, 3, 4, go ahead and close the door. And that's going to correspond to the numbers here. 1, 2, 3, and 4. And so as we go, once again, with your white bar correct side up, we're going to place that into the 1 slot, and you're going to press firmly down until it's seated. And then 2, we're going to pop this into place right there, and 2 is actually pulling this door flange down, which sometimes you have to make sure you're aligned underneath, and it'll click closed for you. Once you have that, then I like to just rest the spikes on the machine where convenient, and we're going to go to 3 and 4. So here it's best to grab the gas vent filter assembly, the bottom of that in your left hand, grasp the pinch clamp in your right hand, try not to let the tubing hit the floor, and we're going to go ahead and floss that tubing into place, and that's technically your number 3 step. And then we're going to seat the gas vent filter assembly, and that's going to be 4. So once again, you're going to snap that in, and then go ahead and close the door. And with that, there's a little tab that we must be wary of here, and we want to make sure that that seats inside this housing, and then snap shut. So sure is seated properly to the inside of that housing. There it is. 1, 2, 3, 4. Go ahead and store that tubing, and then we're going to go and spike our bags. So I'm going to get a liter of NS. That's what this patient is requiring at the moment. And we're going to use what's called the spike, burp, respike method. So we will grab one of our clamps. I would make sure that your pinch clamps here are closed so we don't get a rapid shower of liquid. And I'm going to go ahead and pull my blue tab, pull my spike. I'm going to spike the bag. Once it's spiked, I'm going to go ahead and unspike it. I'm going to burp that air out and re-spike. And once I'm re-spiked, I'm ready to hang the bag. So inside the pressure chamber, there's actually 5 hooks. 5 hooks on the inside. The liter bags, the top 2 are clear, very difficult to see. The other 3 are black, fairly obvious. Liter bags will hang from that second hook, and you can see how clean it is on the bottom. Nice fit right there. We can go ahead and close that now, so that chamber will pressurize once we plug the machine in and turn it on. And you can see that the bag is seated nicely kind of right towards the bottom, and that's going to be our goal for any size bag that we use in there. So to kind of mimic the size of perhaps a PD bag of blood, we have just grabbed a small bag of dextrose, and we're going to go ahead and spike this bag. Same method: spike, burp, re-spike. There's our spike, and our burp, and our re-spike. Now with blood products, the air should already be all quote-unquote burped out of the bag. There should be no air in a blood bag, so we wouldn't have to burp those. We can just spike them and hang them. So now with this, blood oftentimes is going to go off that lowest hook, and you can see how that bag now sits nicely down in the bottom of that chamber. And we'll go ahead and turn that to the plus sign as well. The next step is going to be, before we turn it on, we're going to go ahead and prime our tubing. So the roller clamp right here towards the bottom of the tubing is going to be your best friend, once again, to avoid a shower. So I'm going to prime this bag with the saline, and we're going to fill our drip chamber. It's important to keep your drip chamber only halfway filled so that we can visualize the flow of our fluids, and if this helps with my hand behind it, that's what's going to allow us to know if our fluids are running and how quickly they're running, because there is no alarm for downstream occlusion or any of the sort when it's not running. As you can see, the machine is turned on, I'm clamped, there's no fluids running, and there's no alarm. So keep an eye on that drip chamber. So then once we're connected, we note that our chambers are pressurized. They go to 300 millimeters of mercury, just like a pressured bag they would. And we can go ahead and I'll give you an example of how rapid the flow can be. And you can see that's a pretty good flow. So we can get a lot of fluid very quickly into a patient. Just a couple of things to note. For blood products, we can use blood and FFP, but we do not want to use cryoprecipitates or platelets or granulocyte suspensions, and that just has to do with the speed that we will be delivering fluids and the fact that our filter is right here. So we don't have to add, when we do add blood, you don't need to add additional blood tubing like we typically would in our unit. There's actually a 170 micron filter built in to that gas vent filter assembly unit down here, and that will filter our blood adequately for us. So, and also the other thing we would want to use is an auto infusion bag of blood. So if the patient had previously donated blood to be transfused back into themselves post-surgery, those bags tend to have some air in them, and it's not something we can burp out, because what happens is you put it in here, you pressurize that chamber, and those bags have a tendency to explode, and then we're left with a bloody mess, so to speak. So those are really the basics right there. Once again, make sure that your drip chamber is only filled halfway up, because as you note, I am not flowing right now and there's no alarm. So this is not by any means a quote-unquote smart pump. Some people refer to it as a dumb pump. It's basically a fancy pressurized chamber, and so we're going to want to watch for that flow so we know, once again, that we're flowing. Maintenance is probably going to hate me after releasing all this liquid onto their floor, but sorry, you guys. So keep an eye on the drip chamber to note that the fluid is flowing. It helps if we can have 2 nurses on this during a situation like that, because like I said, we'll be going through a liter bag in a few minutes, and so someone to also watch your IV to make sure that that is not infiltrating would be ideal. Any questions? No? All right, great, thank you.